Steph, thank you so much. It is being called the first of its kind. Joseph Brant Hospital says its pandemic response unit is ready to welcome its first patients this week as they try to manage the increasing pressure on hospital capacity. Chief of Staff Dr. Ian Prera joins me now with more on why a special unit like this is needed as we continue to battle the COVID pandemic. Good morning to you, Doctor.
Good morning. How are you?
I'm doing all right. I should ask you, how are you? How is your staff right now handling the influx of patients?
Well, I think what we've been seeing is increasing pressure on the acute care capacity of hospitals, not just at Joe Brant, but across our region and across the province. And what we're trying to do is find creative solutions in order to increase capacity across the healthcare system, really.
So let's talk about the field hospital itself. Started accepting new patients yesterday, but who are these patients?
Well, one of the things we learned from the first phase of the pandemic is that we're going to get a large volume of patients who may require oxygen therapy and can't go home and need to be cared for in a dedicated COVID designed environment where we can deliver oxygen while maintaining infection prevention and control procedures. Such a space didn't exist, and so we built it. And really, the goal of the pandemic response unit is to act as a regional resource where patients from across the region can come for this kind of step-down therapy to allow us to free up conventional capacity in regular hospital beds and ICU beds so that we can continue not only to deliver COVID care, but also to avoid having to cancel scheduled care.
We've
I
heard.
think
Oh, sorry, go ahead.
I think we all learned a real harsh lesson in the first phase of the pandemic about the effect on the lives of patients and their families when we have to cancel their scheduled surgeries and clinic appointments. And it's something we really wanted to work hard to avoid this time around.
How big of a problem is it right now, doctor, with this backlog and having to reschedule some of these other surgeries that are non-COVID related? How big of a problem is it from Joe Brant?
Well, it's a big problem for patients because our healthcare system, even before the pandemic, was so stretched. And having to defer these scheduled surgeries means it's very, very difficult to keep up and to catch up. So the best way to prevent that is to make sure that we minimize the amount of cancel scheduled stuff that we have to defer.
Now, these patients that are at this field hospital, doctor, they're coming from specific regions, we should note. So sort of Haldimand, Norfolk, Hamilton, Burlington, of course. Do you see more of these field hospitals? Do you anticipate more will be popping up?
So certainly across the healthcare system, different hospitals have looked for creative solution to the problem of creating capacity. This can include field hospitals, but it can also include opening new units in conventional space, extending into hotels and other kinds of space. And I think the solutions are really custom designed for each region. And I think the one that we chose, the one that was most suitable for our region, was this pandemic response unit.
I want to get your take here. We are deep into this second wave of COVID-19, and what are you anticipating when we see numbers? Obviously, you talk to your staff on a daily basis on what they're seeing, how they're handling it. Mental health is a major issue as well as they continue to battle on the front lines. What are you hoping? If you want to leave something with our viewers right now, what are you hoping the message is? Because a lot of people are seeing these numbers and they're hearing these stories, but still, it's just not getting through.
Yeah, I think we all see these numbers and it creates a great sense of apprehension. Look, my favorite thing to see would have been an empty pandemic response unit throughout the course of the pandemic. And our staff have been stretched, and staff across Ontario have been stretched. And people talk about frontline heroes, and I really think that the true heroism in healthcare is having a day like the day we have every day, but waking up the next morning and coming into work. Look, the best way to create capacity is to not get COVID in the first place. And one thing I would urge is we have vaccinations coming and we're vaccinating people as quickly as we can do. And the best way to create capacity and help frontline workers is to not get COVID. And really that means all the things that have become pretty boring. Wash your hands, stay apart, social distance, and wear a mask all the time. Because this has been a marathon for all of us, and we're looking forward to that light at the end of the tunnel. But it's something that we all need to do together.
Mhm.
Solutions Pandemic Response Unit create capacity But what we want to do is ameliorate the suffering in the community that comes just from the prevalence of people having COVID.
Dr. Pereira, appreciate your time. Thank you so much for joining us today.
Thank you. It was my pleasure. Have a great day.
You too.